Heart failure is a common clinical syndrome. It affects around 920,000 people in the UK, so 1 to 2% of adults, so 1 to 2 in every 100 people are living with heart failure day to day. The symptoms that patients experience are things like feeling out of breath, feeling very tired, and their ankles might swell up as well. And that can be quite limiting for patients going about their everyday lives, and also put increased pressure on the people around them that are caring for them. ECHOES is a heart failure screening study, so it stands for Echocardiographic Heart of England Screening Study, but we like to call it ECHOES. And the point of the study was to ask the general population if they'd be willing to come into one of our research clinics and be asked a series of questions, examined by a doctor, and have a heart tracing, which is called an ECG, and also a heart scan called an echocardiogram. And that allowed us to see who did and didn't have heart failure. And that gave us some information about how common heart failure is if you go out and screen the population to try to find it. Heart failure is a difficult condition. We know that survival rates haven't improved very much over the past 20 years, and we really need to understand more about what heart failure is and how the disease progresses over time. So the original ECHOES study was done between 1995 and 1999, and we recruited over 6,000 people, so it was a large group of people which we often refer to as a cohort. And a few years later, so in 2011, we decided to invite back a quarter of the people that were in the original study to be rescreened again. So the same process of being asked questions, examined, and having an ECG and an echocardiogram. And that was called the ECHOES Extension, or ECHOES X study. And that allowed us to find out what had happened to the people who we'd found to have heart failure at the original screen, and also to see who had developed heart failure over that period of time. And in the ECHOES X study, we were able to do extra blood tests called natriuretic peptide tests, which has become increasingly commonly used in healthcare. And that's a way of us detecting heart failure at an earlier stage. The main aim was to screen people for heart failure, but we know that heart failure rarely exists in isolation, and people usually have other conditions as well. So when we were asking patients at the screening appointments those questions, that included what other medications they were on, but also what other health conditions they had. And so we do have an awful lot of information about these participants in the cohort, so we can look at not only their heart failure, but yes, also the other conditions that they're living with. When we ask patients to take part in the original study, we ask for their consent to link their records to NHS Digital, so they hold information about hospital admissions but also mortality data. So NHS Digital know when patients die and what they die from. And since the cohort began, we've had a linkage with NHS Digital to find out that information. This year marks the 20-year anniversary of the original ECHOES cohort being screened, and so we have 20 years of follow-up with NHS Digital data, and we're analysing that to look at the long-term outcomes of people with heart failure, so we can really understand how heart failure progresses over time, and that will allow us to develop new treatments and new strategies to diagnose and treat patients.